Hey everyone, welcome to this MicroSpine Explainer. I am so glad you're joining me. Today, we're taking a close look at a topic that affects literally millions of people, yet it's still so often misunderstood. If you've ever dealt with severe radiating back or neck pain, you know firsthand how it can just completely hijack your life. Well, today, we're comparing the historical standard of care, spinal fusion, with a truly fascinating modern solution, artificial disc replacement. We're going to look at the exact mechanics of both, what actually happens inside your body, and how you can reclaim your natural motion. All right, let's dive right into this. Here is our roadmap for today. We'll start by understanding your spine's motion. Then we'll look at the real problem behind herniated discs. After that, we'll cover the traditional fix, spinal fusion, and the alternative, disc replacement. Finally, we'll compare your surgical options and talk about getting expert care with Dr. T. Let's kick things off with Section 1, Understanding Your Spine's Motion. You know, the spine is just an incredibly complex piece of engineering. It's basically a stack of bones called vertebrae, but it is definitely not some rigid pole. It's designed for multi-axial movement. It lets you bend, twist, rotate, all while doing the absolutely crucial job of protecting your spinal cord and that delicate network of nerves traveling out to the rest of your body. And the secret heroes making all that fluid movement possible, those are your intervertebral discs. Think of them as gel-like cushions sandwiched right between those stacked bony vertebrae. They're basically your body's natural shock absorbers. So whenever you swing a golf club, or bend down to tie your shoe, or just twist to look behind you in the car, these healthy discs are exactly what let your spine do that smoothly, and ideally, completely pain-free. So what happens when things go wrong? Let's move to Section 2. The problem: herniated discs. Every single year, up to 2% of adults will deal with a symptomatic herniated disc. To understand why it hurts so much, we have to look at the mechanics. A disc has two main parts, an outer fibrous ring called the annulus and an inner gel-like center called the nucleus. A herniation happens when that inner gel literally seeps out or pushes through a tear in the outer wall. Suddenly, you've got this gel taking up space in the spinal canal where it absolutely doesn't belong. And the result? It starts compressing and inflaming those delicate nearby nerves we just talked about. The source material gives us this perfectly relatable analogy. Imagine walking with a rock in your shoe. At first, maybe it's just a tiny annoyance, right? But with every single step, it starts causing major discomfort that radiates. A herniated disc does exactly this to your nerves. Just that tiny bit of constant pressure on a compressed nerve creates radiating numbness, tingling, or severe shooting pains down your leg or your arm. And the logic is simple. When you remove the pressure, just like dumping that rock out of your shoe, you finally get relief. Now, let's look at how we've historically solved this. Section 3, Traditional Fix, Spinal Fusion. Okay, let's break down how a traditional spinal fusion actually works. First up, the surgeon completely removes that damaged, herniated disc. But since the disc is gone, they have to maintain the space between the bones. So they insert a spacer, which is often a bone graft taken from the patient's hip or a bone bank. Finally, they literally lock the two vertebrae together with hardware, so they fuse into one solid, immovable piece of bone as they heal. Now, to be fair, fusion surgery generally does what it's supposed to do. It stops the immediate pain by getting rid of the damaged disc and taking the pressure off that nerve. But here is the massive mechanical downside. It completely locks those vertebrae in place. You permanently lose the natural rotation, the bending, and the twisting capability at that specific level of your spine forever. And that loss of motion, it triggers a dangerous domino effect, leading to something called adjacent segment disease. See, because that fused segment of your spine can't move anymore, the everyday stress of bending and twisting doesn't just vanish. Instead, it gets forcefully transferred directly to the healthy discs right above and below the fusion. Over time, this accelerated wear and tear can cause those perfectly healthy discs to break down and herniate too, which means you're often looking at more surgeries down the road. But what if there's a better way? That brings us to Section 4, the alternative, disc replacement. Listen, motion preservation is the new standard in spine care, period. Instead of locking the spine, artificial disc technology uses a brilliant man-made implant that goes right between the vertebrae. This advanced device is specifically engineered to rotate and perfectly replicate the exact normal function of the healthy natural disc you lost. It is a real game changer. Let's look at the objective data here. The pros of an artificial disc are huge. It retains your spine's natural motion, it massively lowers the risk of adjacent segment disease we just talked about, there's no painful bone graft required, and patients usually see a quicker recovery with less blood loss. But we've got to look at the whole picture. The main con is that, just like any artificial joint replacement, it might experience wear and tear over time. So if it's implanted in a younger patient, there's a potential need for a complex revision surgery maybe 10 to 20 years down the line. All right, let's put it all together. Section 5, comparing your surgical options. Let's look at them side by side. On one side, spinal fusion. Your vertebrae are locked, you lose natural motion, and you carry a high risk of adjacent segment disease. On the flip side, artificial disc replacement, you retain your motion, the implant mimics natural rotation, and crucially, it protects your surrounding discs from taking on all that unnatural stress. Especially in the neck, where you only have 6 disc levels to begin with, fusing even one level severely limits your motion. This is exactly why artificial disc replacement has become the go-to surgical option for people who want to preserve an active lifestyle. Which leads us to our final and most important step. Section 6, Expert Care with Dr. T. Here's the thing. Successful outcomes in complex spine surgery rely heavily on your surgeon's specific proficiency, their training, and their volume, meaning just how many of these specific procedures are they doing every year. If you're even considering an artificial disc, you need to meet Dr. Asadatong Trenan. His patients affectionately call him Dr. T, and he is the lead orthopedic spine surgeon at MicroSpine. Dr. T has achieved literally the highest level of training possible in the United States. He is uniquely dual fellowship trained. First, he completed a fellowship in neurosurgical spine at the profoundly prestigious Stanford University Medical Center, tackling highly complex reconstructions. Then, he went on to complete an additional fellowship in orthopedic spine at the renowned Texas Back Institute, focusing specifically on minimally invasive techniques and artificial disc replacement. Finding a surgeon with this specific, high-level, dual-disciplinary background, it's incredibly rare. But technical skill is really only half the equation. Dr. T pairs his world-class Stanford training with deep, personal empathy. He says, and I love this, I always utilize what I like to refer to as the family test when advising treatment and surgical options for my patients. He treats his patients exactly the way he'd want his own family members treated. And honestly, that is exactly the kind of trust you absolutely need when you're making major decisions about your spinal health. So, we've seen the mechanics, we've weighed the options, and we've met the expert. The only question left is, are you ready to finally remove that rot from your shoe and reclaim your motion? If you're tired of living with radiating pain and want to find out if you're a candidate for motion-preserving artificial disc replacement, please don't wait. Call 602-833-2141 today to schedule a consultation with Dr. T at MicroSpine. Thank you so much for joining me for this explainer. The medical science is absolutely here. The only question left is, will you let an outdated, rigid procedure dictate your future, or will you choose to keep moving?